Hello, my name is Jalen Avila, and in this video, I'm going to walk you through how to identify ureterolithiasis or kidney stones using your ultrasound. Now, the easiest way to identify the kidney stones is actually to look for secondary signs of obstruction in the form of hydronephrosis. Now, to do that, you're going to want to use either your phased array or your curvilinear transducer, and you're going to identify the kidney. You should place the transducer with the probe marker facing up in a coronal plane. Place it right at a little above the level of the umbilicus and identify that kidney right there in the center of the screen. Now, if you want to get the rib shadow out of the way, what you want to do is you want to slightly rotate that transducer so that you're along the plane of the ribs themselves and not transversing them. So often you start off with a more coronal plane, and then you'll slightly rotate the probe marker towards the bed until you get an image of just the kidney without any ribs in the way. On the left side, you're going to do the exact same thing, but you're generally going to want to go a little bit more posterior and a little bit more cephalad because the spleen is a much smaller organ relative to the liver, so the kidney is actually going to sit a little bit more towards the head on the left side when compared to the right side. Now, when we're looking at the anatomy here, we have a few structures to talk about and to look at. We have the cortex, which is the outer layer. We have the medulla, which has the pyramids, the renal pyramids within them. And then in the center, we have the pelvis, and that is actually where we're going to look for hydronephrosis. And it's liver up here, but depending on if you're left side or right side, it's either going to be liver or spleen. We can see here that it looks similar to how we might see it in a textbook, just rotated about 45 degrees off of how we're seeing it. Now, the key here is to look at the pelvis, noticing that there is just white stuff in the center, which is a little bit of intrarenal adipose right there in the center. If that is white, we are good. The way that we identify hydronephrosis is the center of that pelvis actually starting to grow outwards from the pelvis out into the periphery, kind of like a plant. I'm going to take a brief pause here just to let you know that all of our content is on the coreultrasound.com website. That is Ultrasound Podcast, 5 Minute Sono, Ultrasound of the Week, Clip Bank, and we also have our courses page where we have the Core Ultrasound Fundamentals and Core Ultrasound Question Bank, where you have 3,200 questions with feedback, including narrated videos explaining the question. Check it out, and back to your video. This right here is mild hydronephrosis. We can see dilation of the proximal pelvis right here, and we're seeing separate renal pyramids off in the periphery. They're not kind of coalesced yet. We look right here. This is a separate one that has not quite coalesced with that mild hydronephrosis. Maybe another one out here. Now we get into slightly worse hydronephrosis, and we can see here as we move into the moderate range that we are seeing that renal pelvis enlargement expand and connect into those renal pyramids. And then if we look at a more severe hydronephrosis, we can see here that we're seeing basically the architecture start to be smushed so much that you can't really tell the difference between the pelvis and the medulla. Sometimes you might actually identify a little bit of fluid just around the capsule, which we're seeing right here. We have some hydroureter here with a little bit of moderate hydronephrosis, and the typical patient scenario is they will have pain and it will get slightly better. What happened here is that one of these pyramids actually ruptured, spilling into the capsule of the kidney, causing there to be some free urine within the capsule, but outside of where we typically see it. Next, let's move on to the actual identification of kidney stones, which we're less good at typically, because especially if the stones are in the mid-ureter, bowel gas typically is going to obstruct those views, but there definitely are times that you can see them. In this example, we see a kidney stone that is actually a kidney stone. It is an intrarenal stone right here. It's hyperechoic, maybe a little shadowing deep to it. And this one is not causing any symptoms because remember, it only causes symptoms when it actually moves down the ureter and scrapes the walls of that ureter. Now, this is a stone, but non-obstructing, not causing symptoms today. And this is what an obstructing larger stone looks like. We are seeing this here in the pelvis. We are seeing some dilated pelvis extending into the pyramid. So I'd say this is probably mild to moderate because we're seeing some pyramids that aren't coalescing with the pelvis. We're seeing this with good shadowing, dark shadowing, which is typical of stones, deep to that stone right there. And we can actually kind of compare this to how it would actually look on a CT scan. And there we're seeing the stones on this non-contrasted CT scan that we're also seeing on this ultrasound. And we can see another one right there with some shadowing. And we're seeing that other one in this area right here. Now here is that same patient, same image, but we're now seeing the bladder, and we can actually use the bladder ultrasound to identify if the patient has an obstructing stone or not. We throw color flow in the transverse plane in the bladder, trying to identify those ureteral jets into that bladder. Notice on the left side, we are seeing good flow of that ureter into the bladder, but over here on the side where we expect there to be some additional color Doppler flow, we're not seeing anything, likely because of that stone up there completely obstructing that area. And if you want to make 100% sure, the right time frame to be looking at this to see if it's obstructing is 5 minutes. So this was a ureteropelvic stone or a UPJ stone. Here is an example of a UVJ stone, a quite large one. This is the transverse view over here. This is the longitudinal view. And we're seeing the stone here with shadowing and a fair bit of hydroureter. Another thing that we can do if we're not sure if the stone is present or not is we can look for something called the twinkling artifact, which you're seeing here. The twinkling artifact is when you place color Doppler over an area where you think there's a stone, and if you see this color Doppler twinkling around that, it is thought to be one of the signs for an actual stone. You can see this in other structures as well, but it is most commonly seen with kidney stones. And as far as how it's formed, it's unclear, but the theory that makes the most sense to me is that there are some minute vibrations that the sound waves cause around that stone, causing there to be this interesting twinkling artifact on color Doppler. You can definitely see other things with your ultrasound. This right here is a kidney, and we see a very large stone here with shadowing deep to it. This is a staghorn calculus and is something that we can easily visualize on ultrasound. Now, a couple other things to think about when you're doing a kidney ultrasound is what cysts look like and then what a solid cancer looks like a renal cell carcinoma. So notice over here that the cyst is just peripheral. It's not starting from the center of the pelvis and expanding out. And then over here, we have just a solid lump basically on that kidney, which is what a renal cell carcinoma looks like. So this is hydro. We have the hypoechoic urine starting from the pelvis and expanding outwards. A cyst, we just have a fluid collection, thin-walled and circular on the periphery of that kidney. And then over here on the periphery as well, we have a very solid non-cystic structure indicative of renal cell carcinoma. That's it for this 5-minute Sono video. I hope to hear from you soon and happy scanning.